Hi, I'm Alicia.
And I'm Robin, and you're listening to Bowel Moments,
the podcast sharing real talk about the realities of IBD. Served on the rocks. This week, we talked to Mara Shapiro. Mara was diagnosed with Crohn's disease after dealing with iron insufficiency. We talked to her about that and the treatment that she got to deal with it. We talked to her about her chronic C. diff infections and using Fecal Microbiota Transplant to deal with them. We talked to her about her other health conditions, and we talked to her about how to become a fierce healthcare advocate. And we also talked to her about her involvement with the CCYAN and Generation Patient. Please keep in mind that the views expressed are those of the speaker and should not be construed as medical advice. Cheers.
Hey, everybody. Welcome to Bowel Moments. This is Robin.
Hey, guys. This is Alicia, and we are absolutely delighted to be joined by Mara Shapiro. Mara, welcome to the show.
Thank you so much for having me. I'm so excited to be here.
We are delighted to have you, but we're going to start out by asking you the very unprofessional question of what are you drinking?
Well, I am currently drinking decaf coffee.
Robin's going to get on your case about the decaf part of it.
No, look, I don't want anybody to come at me for drinking regular coffee, so I can't come at anyone else for drinking decaf coffee.
All right, fair.
It's fair. What are you drinking, Alicia?
I am drinking a raspberry gimlet.
Okay, how do we do this? I am drinking raspberry lemonade. We usually have blueberries together, and now we're both having, they look the same.
They do look the same. We spend too much time together.
We spend too much time together.
Well, Mara, again, welcome to the show. Next question for you, Mara, is tell us your IBD story. What brings you into our community?
Yeah, well, my IBD journey has not been on too long, even though I feel like I have been here for a very, very, very long time. But I guess that's what happens when you get diagnosed during, or at the start of the pandemic, rather, when time kind of is just time. So I was officially diagnosed with Crohn's disease in July, August of 2020. After a very tumultuous and confusing diagnosis journey, I would say I've had, was having GI symptoms for about 2 to 3 years prior to that. I actually had at least 2 C. diff infections before I was even diagnosed with IBD. And I also have a family history of IBD. My uncle has ulcerative colitis. So it kind of even now is a little funny looking back that it did take me so long to get diagnosed, but it did. What kind of actually led us to the actual diagnosis was about a few months before the summer. I was just extremely fatigued and not feeling great. My doctor had run, just a splattering of blood work, kind of threw a bunch of things at the wall to see if they could find anything abnormal. And my ferritin, one of my iron levels, came back at 5, which is extremely, extremely low, and would kind of explain to a T all the extreme fatigue and lightheadedness and dizziness, and was having like memory loss issues and was just kind of like barely getting by. But I think like most of us in March of 2020, that's kind of how we felt. So I think to a certain extent, some of those symptoms made sense in the context of life at the time. But as soon as I got that first iron infusion, I felt so much better. And I think I was getting at least one a week for 4 weeks. And by the end of that, I was like, wow, I can conquer anything. And then kind of the GI symptoms started to get worse, and kind of the symptoms started to come back just as quickly as some of them had been alleviated with the infusions, and partly due to everything going on and how difficult it was to get anything done outpatient wise. I actually ended up at the Mayo Clinic in Rochester, Minnesota to get diagnosed. It actually took 2 separate trips out there that summer to get the diagnosis. We were out there. My dad and I drove out there with my dog Morty in the car. It was a 20-hour drive from Southern California to Minnesota. We got out there and ran a bunch of tests and continued to find out what was not wrong before we found out what was wrong, which was extremely frustrating and felt a little bit invalidating. But the team of doctors that I had there were really, really great, and definitely, I was able to put faith and confidence in them that they were going to help figure out what was wrong. But my first trip did not include a colonoscopy. Don't know why. I ended up getting some interesting tests like an esophageal manometry and a pH study to kind of look at acid reflux that I had had for years that I thought was well controlled. And so obviously none of those tests showed anything blaringly obvious. So we went back, and again, once we got back to California, we were maybe home 10 days. My blood counts started to do crazy wonky things again. My hematologist was like, you're bleeding from somewhere. You're not absorbing what you should. How quickly can you get back here? So we turned basically right back around and drove all the way back to Minnesota. And on that trip, they were pretty quick to do a CT enterography, which showed, scarring and inflammation in my ileum. The next morning, I had a colonoscopy that confirmed and diagnosed Crohn's disease. So yeah, it was a moment of pure relief and almost joy. Honestly, when I woke up from that colonoscopy, I was in tears, and the doctor thought that he was delivering me a death sentence by how much I was crying. And I had to tell him that, no, I'm extremely thankful that, he just gave me my life back. And in that moment, I had no idea what living with IBD was going to look like for me, but having an answer, having a word for it meant everything to me in that moment. So I came back to California, got, established with a local GI, unfortunately went through the agonizing trials of getting biologics covered by insurance. So I spent my first few months of having IBD without any treatment at all because I couldn't tolerate steroids at the time. So I kind of was just left circling the drain a little bit while we fought with insurance to get Stelara approved, and had my first infusion of that by the end of October of that year. And thankfully, 4 months later at my next colonoscopy, I was already in remission. So I was very, very lucky to have my first biologic work and have it work quite quickly. So yeah, I've been doing quite well on Stelara ever since, and very, very thankful that I have amazing access and, the ability to afford that medication and everything like that. And so IBD wise, things are, I think, as good as they can be, but as a lot of our community knows, it's never usually just one thing, and a lot of things can kind of throw the IBD for a loop. So yeah, I guess I would say that's my diagnosis journey in a nutshell.
So we have had people talk about having iron infusions on the show. Robin has talked about her getting iron infusions, and I've actually had iron infusions as well, not for IBD, but for other things. You mentioned getting iron infusions and feeling so much better, but what was that process like? Did you have, did your doctor try you on oral iron before you went straight to the iron infusions, or just because you were so low, you went straight to the iron infusions? Talk us through that process.
Yeah, I do believe when I was like a teenager, I also have postural orthostatic tachycardia syndrome, POTS, very, very well controlled, almost kind of like grew out of that. I know, very lucky. I guess in a sense, those symptoms don't really play a role in my life currently at the moment. But I remember when I was newly diagnosed with POTS at 17, they did try to get me to take the oral iron, and I maybe took it like a week, and I was like, this is a joke. Like, you're supposed to make me feel better. Like, I feel so much worse. And I know that is a general, experience people have, especially with like being nauseous and just not feeling well GI wise. So kind of after that, like not so good experience, I have not in the future been open to the oral iron, but definitely in this context with my levels being so low, the hematologist was just like, right away, you got to get a bunch of them. And yeah, I honestly think that first week I got 2 in 1 week. Like, it was just kind of like a lot. And I know you can get too much too soon, and you can like have symptoms and side effects from that. But I think I was very, very lucky. I tolerated the infusions really well. I think I was like tired and had like a little like facial flushing. And like, there was a moment where the nurse was like, do I need to get an EpiPen for you? Like, is this going to like progress? And I was like, what are you talking about? I feel fine. And she goes, your face is like really red. So other than that, I tolerated them quite well. So I think I've had at least one more round of like 4 weeks of them since that initial kind of like pre-IBD diagnosis phase. I think kind of that fall when I was still pretty sick before I started Stelara, I got another like month of infusions. And then we kind of just check my levels like every few months. And thankfully they've been pretty stable. And I think a lot of that too is obviously having some intestinal healing, being able to absorb more things and being able to eat a lot more finally. I think kind of I'm getting a lot more iron from my diet nowadays, which is exciting.
I'm always jealous of people who feel an immediate response when they get iron infusions, because I do not feel immediately better after iron infusions. I know I need the iron. I mean, my blood work says I'm clearly very anemic. And I'm usually like every 6 months, I have to get iron infusions again. Even though I'm clinically, endoscopically in remission, I still have to get iron infusions like probably every 6 months. But I am so jealous of people that feel better immediately. Did you feel better immediately, Alicia?
I did. Yeah, I did. It wasn't like so drastic that, because I obviously wasn't in Mara's situation where mine was super, super low, but it was low enough that they're like, let's do it this way. And I did get pretty sick off of the supplements. And so they're like, we'll just do the iron infusions. And I actually actually did react to it. They ended up having to give me Benadryl, but I ended up like having just like these little floaters. It was like little just kind of bubbles that were like in the peripheral vision. It was really wild. And so they were like, oh, you're probably allergic. And so the next time I came in, they gave me Benadryl and then they gave me the infusion and I was perfectly fine. It didn't happen again, but I did feel better. I think the weirdest thing for me was that I did it in a cancer unit. And so I was like infused at the hospital, walked in and like all these other people are getting like, their chemotherapy. And I was like, this feels weird. So I remember being really uncomfortable, like being there because I was so patently well compared to everybody else. So that was a little bit strange.
Yeah, no, it's interesting you bring that up. I had a lot of issues with getting mine done at the cancer center as well. My mom passed away from stage 4 breast cancer when I was 8. So I had a lot of issues with like my medical trauma and PTSD flaring up when I had to go get those infusions for sure. And I don't have a lot of memories of my mom being sick and me going with her to appointments, but I definitely have memories of going to the infusion center with her getting chemo. And I was sitting there playing my Nintendo DS Lite. I was a little 6-7-year-old. So it was definitely really difficult for me to kind of get through that. And obviously it was at the height of the pandemic, pre-vaccines. So obviously you can imagine one of the places that was most fearful of COVID infections was the cancer center and those infusion centers. So they were not flexible at all on their visitor policy. So my dad would like walk me in and have to sit in the car. And I remember one time he even like offered to like stand outside the window because I was just so anxious. And I brought my corgi blanket with me. And so I could kind of feel like my dog was nearby, but it was definitely one of the hardest parts of that journey for me, despite knowing I needed to be there and knowing that those infusions made me feel better. It was definitely one of the hardest parts for me. And I guess kind of an interesting segue into when my doctor was, giving me options for biologics, we were deciding between Stelara and Entyvio. And I told her, I'm sorry, I don't think I can be as compliant if you put me on an infusion biologic, because for me, after just having gone through like over a month having to be at the infusion center, I was like, that is not the best for my mental health and well-being right now to feel so reliant on a place that was just so triggering and difficult for me. So I was really, really lucky that she was really understanding of that. And, through shared decision-making, we agreed that, an injectable medication would be a lot better for me in the long run.
I'm glad that you brought that up with her because you can have that discussion that's going to get you to the right option for you. I'm going to do a Robin PSA moment here. The other thing I would say is you don't have to do it at a hospital-based infusion center, which a lot of times those are the oncology units. You can go to ambulatory infusion centers, and there are some places that also do home infusions if you really want to do it that way. So you have other options. You don't have to go to the one that they tell you have to go to. You have options that you can go out and seek care outside of the hospital setting. And some of these ambulatory infusion centers, these standalone infusion centers are super nice and have like snacks and TVs and like it's a kind of a nice place to go. So just as a note, the power is in your hands for this, so you can decide where you want your care. One thing that you mentioned, looking at your ferritin and seeing that it was really low. I myself know that I have anemic issues and I still don't know what I'm looking at when I look at my labs. So just curious if you, as a patient, since we're talking to a lot of patients, what should patients be looking at so that they can also look at their labs and feel like they have a better understanding of what they're looking at?
That's a really insightful question. I think too, what was unique about my case was my hemoglobin, my red blood cell count was actually stayed normal throughout this. So I had what they were calling a very severe, interesting case of iron deficiency without anemia at times, but yet they were explaining that because I was so young that my bone marrow was able to like compensate, but that towards the end, because I had been doing that for so long, my hematologist was explaining that I would hit a point where my bone marrow would like stop doing that and then it would get really bad. So that was very interesting to me to hear all of that. Yeah, so I learned a lot about the ferritin level in particular, and that sometimes those have to be interpreted differently and kind of separately from the hemoglobin. And you can have serious benefit from iron infusions, even having a normal hemoglobin. So that was something that I learned a lot. And then it was funny, for at least a year or two, I had a spreadsheet where I tracked my ferritin, my hemoglobin, my total iron binding capacity, the other thing that comes in the iron panel that I can't remember. I had a spreadsheet where I tracked all of that and plotted trends and when I had my infusions and bring that to all my appointments and be like, I think I'm needing another infusion because you can see here that the levels are starting to go down. And so, I'm totally that patient that walks in with the spreadsheet.
Oh, I love that so much. But it sounds like you're not doing it any longer.
Not with my iron. I track a lot of other things in spreadsheets though.
Good for you. I like that. I think you are the first person we've talked to that was the reason that their IBD was really diagnosed or caught, was because you got that anemic. You mentioned having some other GI symptoms for the 2+ years before you actually were diagnosed. Were they unusual symptoms? Is that what prevented you from getting diagnosed? Tell us a little bit more about that.
Yeah, it's kind of interesting. So when I was 16, I was diagnosed with latent tuberculosis. I volunteered to work at my children's hospital because even as a young teenager, I knew I wanted to, or I thought I wanted to have a career in medicine. So I was doing that whole thing in high school where you're like, let's start volunteering now. So through that process, they did a TB test and it was very positive. And I did the blood test and it was also, very positive. I had a chest x-ray that actually showed lung calcifications. And they're like, oh, wow, like you have had latent tuberculosis and like you were definitely like exposed. And I like my whole world was flipped upside down. I had no idea what that meant. I've done some international travel over my lifetime. My sister was adopted from China and I went on that trip when I was 5. I had within the past year traveled to South Africa with family, but no one else in my family had it. Like my dad did the TB test and he doesn't have the same latent infection. So huge mystery. We still have no idea kind of how that happened. Clearly, I don't have a known contact with someone that had tuberculosis. So it's kind of very interesting that happened. So I struggled a lot with that treatment. So they recommended, prophylactic 9-month course of antibiotics. And within like a month, I got extremely sick. I was nauseous. I couldn't eat. I lost all this weight and just felt like a shell of a human being. The doctor like couldn't really explain it. The infectious disease doctor was like, most people just like pop this pill once a day and like for 9 months and totally fine. So I ended up cycling through the 3 different treatments that you can take for it because I couldn't tolerate the first one. I tried the second one. It was even worse. And I ended up finally completing the third approved latent TB treatment, which is you take for 12 weeks, once a week, that you take huge doses of these 2 drugs. So I did that for 12 weeks and finally got through it. But so throughout that, they kind of didn't know what to do with like nausea, diarrhea, stomach pain, the fact that I wasn't eating and getting severely malnourished. They didn't really know what to do. They're kind of like, we'll just make it through the end of this treatment and then we can like evaluate you. I like lived on Zofran. Like I know what that stuff is, even pre-IBD. So after that, as one could imagine, after taking 9 months of very strong antibiotics, I had got C Diff for the first time. So that was kind of, I guess, once when I was welcomed into the GI world and finally added a GI doctor to my specialist list. And it was a very like hypervirulent, highly, drug resistant strain of C Diff. They were able to somehow determine that. So again, I kind of went through every treatment under the sun at that time for C Diff. I tried Flagyl, it didn't work. It came back. I tried vancomycin, it kind of worked, but then it came back. I did 3 months of vancomycin and then I was fine for like a few months. And then it came back. And this was the time when fecal transplants were still a little bit too new. This was in 2017, 2018 when I was dealing with all this. And I was still in the pediatric space too. So there was even less research kind of going into all of that. I think I had a colonoscopy at one point and I didn't have a perfect prep. So I am convinced that the Crohn's was missed at that time. And kind of because of that, I joke with every doctor, I am now like the most perfectly prepped patient. It's like a gold medal, like winning sport for me. Like if the doctor says it wasn't squeaky clean, perfect, like I didn't do good enough. So after that, kind of like maybe they missed my IBD in 2018. I'm always like, no, you tell me I need to drink the whole thing. I'm drinking the whole thing plus extra to make sure that you can get everything you need.
I feel you. I want an A+ on my prep.
I feel such a level of pride. Like if they're going in there, it might as well be perfect. Like they always know.
I want other people to come. Yes, me too. Last time, even the follow-up person was like, "Oh, you had such a good prep." I'm like, "Yes, I did."
Yeah,
exactly right.
So yeah, I think that was kind of, how all the GI issues started. A lot of them were around C Diff. But yeah, I had just like chronic nausea for like 4 or 5 years. And that was really difficult to deal with. Kind of to the point now where I get nauseous about anything and it's like triggering for me. It's like very hard to kind of sit with that after like years of like sitting here like, how did I live like that for years? Kind of now I'm in this like rediscovery phase with food still. Like I can finally eat and enjoy food for the first time in 4 or 5 years. And it's incredible. Like it's an incredible experience to enjoy food again after having it be such a huge source of stress and agony in my life for a really long time. So even though, like I said, this IBD diagnosis is somewhat recent, it kind of feels like I have been living in like the realm of chronic GI illness for a lot longer.
So you mentioned fecal microbiota transplant, because I got that wrong on Dr. Gurham's episode. So it's fecal microbiota transplant. The third time you were diagnosed, when your C. diff came back for the third time, is that what they did for you? When did that come into play? Because you did have that done at some point.
I did, yes. So I honestly have totally lost count. I've had about at least 10 C. diff occurrences over the years because I've had to be on antibiotics for a lot of things. I started Stelara. I unfortunately have then dealt with extremely chronic severe sinus infections. I've had 2 sinus surgeries as a response to trying to deal with that. So I've been on a lot of antibiotics. I've also had some cellulitis infections from my cortisol pump. I had one over the summer that actually went so deep in my leg, it was like attacking my femoral nerve. So unfortunately, over the years, I have not been able to avoid antibiotics. We're obviously extremely, extremely cautious and only use them when utterly, completely necessary, like a Pseudomonas infection trying to rip through my leg. You need to give that whatever antibiotic it needs and deal with the C. diff later. So unfortunately, I think this summer was really when it got super bad. We were like, come on, this is like the third time you've had C. diff this year. I kind of at that point like threw my hands up and was like, I can't live like this anymore, because also my Crohn's has been in remission now for a year and a half. So every time I would struggle with like a flare, it was always a C. diff flare. It was really never like my Crohn's coming back, but it was so fearful to live in that. Most of my Crohn's is in my small intestine and my ileum. So I'd be like, oh my God, it's in my colon. Like, I'm so scared. And like my doctor would be like, no, Mara, like it's just C. diff. Like I'd go in so scared, like I'm in a flare, I have a fever, like this must be bad. And she'd be like, bring me a culture for C. diff. Like clear, like she'd be like, don't freak out yet. I'm sure it's just C. diff. So that's kind of how it started to go. Like all of my flare phone calls and appointments ended in a C. diff diagnosis. So we kind of were like, this has to end. So at the time I was working for a company in the IBD space and had some connections at Mount Sinai, and was able to get an appointment fairly quickly with their fecal transplant dude. And he came running into the room, was so excited to meet me, and actually was still enrolling in a clinical trial for FMT in patients with IBD as well. So I enrolled in that clinical trial and was very happy to be told that I'd have to pay absolutely nothing out of pocket for this procedure, because I thought it could get covered. And he was telling me there's no way, still, considered experimental by the FDA, and that I'd have to pay out of pocket for it had I not enrolled in his trial. So that was kind of all I needed to hear to sign the papers and kind of move forward with that. So I had finished up a course of antibiotics for that current infection. And then a week later went back up to New York City to get the FMT done. And it was the worst experience of my life. The procedure itself was, I don't think I have words for what happened in the aftermath of that procedure. This is the first time I'm telling the story live. No, I'm kidding. So it was a little anxiety provoking beforehand. It was like my first time at Mount Sinai. The floor that I was on did not have beds. They didn't have like pre-op rooms like I was used to. I was sitting in like a chair with like barely a curtain separating me from the person like 6 inches away from me. There was like a lot going on. I felt like I was in a slaughterhouse, is like what I kept telling my therapist afterwards. And she's like, that is a terrible description. And then I'm like, no, but that's like bear with me, please, because that's like how I felt like I was getting lined up to be slaughtered. So it was quite like a stressful beforehand. I see them run in with my new poop, and I'm like, oh, yay. And then I start freaking out. And my doctor, he's an incredible physician, but an even better human being. He saw me like freaking out, like eyeing the door. And he came over and he sat with me and he held my hand and he was like, it's going to be okay. And I kept asking him, where's the Versed? And he was like, it's coming. It's fine. You're going to be okay. Then they made me walk back to the procedure room, which I've also never had happen before. So this whole experience beforehand was kind of like some like bad omens for what was to come when I woke up from the procedure. But so I get in the room, they put me under, everything's fine. I wake up in recovery, thankfully in a bed and not in a chair, but that wasn't was a fear of mine that I was going to wake up in the same slaughterhouse room that I was in before. I wake up and there's this nice, cute nurse that'll kind of come into why the story's so funny a little bit later. He keeps asking me, are you okay? How are you feeling? How are you feeling? I'm like, I'm fine. Like, I'm sleepy. I just woke up from propofol. Like, give me a second. And he keeps like asking me, like, are you okay? How are you feeling? How is your stomach feeling? And I'm like, I'm fine. And eventually I said, why do you keep asking me if I'm fine? And he goes, well, I'll wait till Alicia puts her drink down. He goes, well, a lot of times when people wake up from these procedures, let's just say it gets really messy really quickly. And I go, what? He goes, you have to let me know when you think you have to go to the bathroom, because I have to rip all of this off of you and get you to the bathroom. And I go, no, that's not going to happen to me. It's not going to happen to me. He goes, what do you mean? I said, I didn't just go through this whole thing to shit out my new shit the second I wake up. And he laughs and he goes, they all say that. And I just like looking at him like, no, there's no way. I feel totally fine. Right. So I'm like in and out, like still groggy, waking up. And then all of a sudden I'm like, oh God, I think he's right. I started to get like cramping and I started sweating and I got nauseous and I was like, oh no. And he goes, how are you feeling? And I'm like, I'm fine. I'm fine. He goes, you don't look fine. He goes, please try to give me like 10 seconds. He goes, 10 seconds, we can make it. And I'm looking at him like, no. And then they bring my dad back because they think like, oh, you're ready to go. And I'm like, and my dad's like, you don't look that good. And I like yell from the nurse. I'm like, you were right. I have to go. And he was like, you can do it. He's like, breathe. And I have never experienced pain and urgency like that in my entire life. He's like ripping the IVs out, ripping the things off me. I didn't even care that I didn't have a gown in the back. He was like, roll your feet off the bed, but like, don't get up yet because you may pass out because you just woke up. And I'm like, I am going to die. And he's like, you're not going to die. He goes, if you shit all over me and all over the floor, it's fine. It happens like almost every time. And I'm like, no, it's not going to happen. So he kind of like grabs the gown from the back as I'm like sprinting the like 20 feet to the bathroom. And I like made it like with minus a half second to spare. I was like, oh
I feel like
my
we
God.
should be applauding. I feel like we should come off like that is impressive.
Where's
Very
my gold
impressive.
medal? Again,
Yes.
I had a perfect prep too.
I am on
mind
the
you.
edge of my seat for this story, by the way.
Yes.
I'm like, what's
Yes.
happening?
Oh, so I made it in the dark, explosive, all my FMT. I'm just sitting there like, what the hell was that for? I didn't want anyone to talk to me. I didn't want anyone to look at me. I was so upset. But it was fine. The nurse was like, it's fine. It supposedly still worked. And I was like, there's no way. There's no way. And to give some context, it's 250 cc's of poop that they spray in your colon. That's like, it's a quarter of a liter. It's like a lot. So I don't know why the thought didn't cross my mind that like they're putting that much volume in, your body doesn't like know what to do with that. So finally I like get out of there. It's like, no offense to people that live in New York City. I'm not a city person. I don't like New York City. Like get back in the car. It's like city. I'm just like, everyone's just meh. We get back to the Airbnb and my doctor calls me and he goes, how are you doing? I go, not good. I say, why didn't you tell me that that was going to happen? He goes, well, some patients it's right away. Some patients it's a few days. And I'm like, it was like 7 minutes after I woke up. And he was trying to explain to me that it's fine. It's like, it's still coated enough of like my colon. And my dad, hilarious, God bless him, was like, Mara, think about it like shake and bake chicken. He's like, you put, marinade and, coating in a bag and you shake the chicken in it and you take the chicken out and it's still marinated, right? He's like, that's what they just did to your colon. And we've used that metaphor ever since.
Thank you, Dad.
Yeah. My colon was shaked and baked with new poop. And despite that total hellish, torturous experience, I felt fantastically better within 1 week. Like all of that, you thought it was likely going to have a bad outcome. I'm telling you, this fecal transplant has changed my life. Now, I will further explain how. I have now experienced constipation for the first time in my entire life, which is not that fun, but kind of fun because I've never experienced it before.
Like, congratulations. That's
I guess it's weirder when I say
prize,
it out loud.
a gold medal for that too. I mean, I haven't been constipated in, over 23, 24 years. So I totally get that. Yeah.
It's a new, interesting reality to live. So it definitely did something to my like entire gut and pooping experience for sure. And I now can eat and love spicy food again. I haven't been able to eat spicy food since I was like 12 or 13 years old. And ever since this transplant, it's like food doesn't taste right to me unless it's spicy, which I keep telling them when they do my clinical trial calls. And I'm hoping that'll like make it into the paper somehow when they publish these results. Patient reported love of spicy food. Maybe my donor like really liked spicy food. That's like the joke that we all have now. But yeah, like I put sriracha on everything and it's hilarious. It freaks my family out because they're like, what are you doing? You can't eat that. And I'm like, yes, I can. So
my new poop allowed me.
Literally. So yeah, it started off as what I thought was like going to end in what was total disaster. I thought there was no way that this is going to have worked for me, but it definitely has. In all of my follow-up stool studies, I've had no C Diff. It even got rid of like what my doctor had called permanently colonized infection that I had. So I don't know, but like 7 minutes of shake and bake repopulation, as my doctor calls it, definitely did something. So
that is absolutely fascinating. And you haven't had any C Diff infections since then?
Correct. And yeah, and the studies show too that the patients are most likely to recur within like the first 2 to 4 weeks. So it's been 4 months now. So not that I'm always in the clear, but we're all really, really excited.
Have you had to do any antibiotics in the interim?
No, I did have a pretty bad sinus infection like a month after, but I was able to treat that with like sinus rinse antibiotics. Mm-hmm. So that was a little scary right off the bat. I was like, like there is no way. And I kept telling my doctor, I am never doing this again. He kept telling me, if you recur, you can get another one. And I was like, well, that's great for the person who would say yes to that again, but it's not going to be me.
I mean, at least you know what to expect this time.
Right.
No?
Maybe. I don't know. Well, and it's hilarious because you wake up from the procedure and they give you Imodium. And I'm like, that didn't work. Hello. Like, it's not that fast acting.
No, I was like, unless they put it in with all of the poop, then no, it probably, and
so I told him
bottom up, maybe.
Right. I told him next time, I said that Imodium was a joke. And next time you're giving it to me beforehand. And he goes, well, they don't really like you swallowing things before anesthesia. And I go, I don't care.
Well, and like how many people have emergency surgeries where they've eaten or drank things, and then go into surgery. So come on. I think it's that.
I know it's like maybe risk mitigation, but I was like, there is no way I am doing that the exact same way ever again.
Maybe they could do it as a suppository.
The actual FMT is very interesting. They
no. The
Imodium thing.
Yeah, they could do like
I needed a cork is what I needed.
Yeah,
exactly. After that procedure.
Just pop it in there like a little tampon. Just plug it up. It'll be great. And then you just explode. That would be bad. That would be really bad. Oh my gosh, listen, we're gonna solve this problem. Just shaking your head at me.
I'm loving this conversation so much because we've never had anybody on here that has had this, or at least has been willing to talk about it in such specific and minute detail.
Glorious descriptive detail. Yes, I am here for this. I love it.
Me too. Love it.
Well,
so
and
thank you.
I really think that the lesson that you provided to this doctor, however, is very valuable because I think somebody should have sat you down and been like, okay, Mara, here's what you're going to expect. You're going to sit in a cattle guard for a little while. It's going to suck. You're going to be worried. Then you're going to go in here. You're going to walk yourself to the room. And then this is going to happen. And then you're going to have explosive diarrhea and you're going to be super pissed. Like, I think if somebody would have said that to you, like, my expectations are managed. I don't love it, but it's managed. Like, I feel like it's very valuable for you to tell them, like, this has to be part of this process.
Right.
I would be mad if I was you too. I mean, if I was in that situation and I had just spent all of that time prepping and doing all this stuff, and then all of that stuff came out, I would be livid. So
Yeah.
I'm with you.
My doctor had to run to another case, so he didn't see me afterward. He had called me an hour later, and I texted the study coordinator, texted me, and he was like, how was it? And I told him over text what happened. And he was like, he sent me back the laughing, crying emoji and was like, you're going to be okay. It's okay. And I'm like, thanks. But also like, I'm telling you this so you can tell the next patient. So you're right. I was so mad because I'm like, the nurse who cleans up everyone's post FMT shit from the floor is the one who's telling me how the experience goes. I felt a little like deceived, I think is a good word to kind of describe how I felt. And I just want to say too, to people listening that like are, considering an FMT or that's something that's been brought up to you, please don't let this kind of bad, but mostly also hilarious experience, sway you or scare you away from getting this done. Like I said, medically, it has totally saved my colon and was 110% the right thing to do medically. I just hope this gives you a laugh and also gives you some insight into what could happen, and ask your doctor for some Imodium before the procedure or a way to mitigate that PACU poop explosion that will likely occur. That's all.
For educational purposes only.
That's right.
Yes.
Wow. Okay. Fascinated by all of that. You've mentioned you have a couple of other health conditions that have been sort of in play for some of this. How have they interacted with your inflammatory bowel disease? Talk about living with all of these multiple conditions and trying to, again, coordinate care amongst them and with your doctor. So give us your other health history, maybe is how we start that out.
Yeah. I think it's very interesting because my IBD definitely played a very interesting role in my diagnosis with Addison's disease, which is autoimmune adrenal insufficiency. So basically my adrenal glands died. They don't produce any cortisol anymore. And cortisol is a hormone very, very necessary to a lot of bodily functions and living. I had no idea really what it was until my doctor told me that your adrenal glands make 0 of it currently. So that was an abrupt diagnosis that I really didn't have any clue what it was, which is kind of the opposite of my IBD diagnosis, where for kind of a few years, I kind of had a feeling that was the road we were heading down. But what was very interesting with my AI diagnosis was that I was convinced it was a Crohn's flare. The symptoms were so very identical. I was really nauseous. I was having a lot of abdominal pain. I was having diarrhea. I was losing weight. I basically felt like I felt when I was diagnosed with Crohn's. So I had just moved to Virginia to attend a post-bac program after graduating college and was thrown into this extremely accelerated, pre-med post-bac program. I was in class from 8 a.m. till 8 p.m. and it was incredibly stressful and very difficult. And almost immediately, unfortunately, these symptoms just escalated. And I was like, oh my gosh, I can't keep up. Something's wrong. So I called my GI doctor and told her all my symptoms, and they got me in for a CT right away. And it showed nothing. They're like, you don't have any active inflammation. All my stool tests were fine. Everything was coming back fine, but I still felt super sick. So I unfortunately had to leave the program. I moved back to California so I could, have the help of my family. And I immediately, the week I got back to California, met with my GI doctor in California who has known me quite well. And she took one look at me and she's like, I don't think this is Crohn's. And I'm like, I know. No one thinks it's Crohn's, but I don't have anywhere else to go. What do you think is wrong? And interestingly enough, I had gotten a lot of bug bites. Summer in Virginia is like gross. And I had poison ivy and bug bites, and I was this like itchy mess. And my primary care, like the week before I left Virginia, gave me a week of prednisone. And historically, I had never tolerated prednisone well. I would get anxious. I would get depressed, like suicidal thoughts. Like I would go like psychotically not good on prednisone. So it was like listed as a drug allergy of mine for a few years so that they didn't accidentally give it to me during a procedure, because I was like prednisone, Decadron, the devil in my eyes for a lot of years. So she gives me prednisone and I was so desperate because I was so itchy and had issues with all of that. And I had these symptoms that I thought were IBD, and I thought, oh, maybe the steroids will help. I felt fantastic. So that was weird. That kind of freaked everyone out because we thought I'd like go crazy like I usually do on prednisone, but it like made me feel great. So I go back and I tell my GI doctor all of this, and she goes, you have adrenal insufficiency. And I go, what is that? And she goes, you need to see an endocrinologist. Like, I'll take care of it. And she's like, I am like almost confident that that's what's going on with you, purely from like the symptoms, the history, and the fact that I could all of a sudden like love prednisone in my body. So, a week later, I saw the endocrinologist. I did what they call an ACTH stim test, where they basically inject this hormone into you to see if that triggers any production of cortisol. And my levels before the test were less than zero. It was like less than 0.1. And after, it's supposed to go up, and mine went to 0.3. And, basically the adrenal glands have left the building, and they were like, you have adrenal insufficiency. It's most likely autoimmune. Some patients with IBD actually get adrenal insufficiency from being on prednisone for a long time. Being on long-term steroids can actually like shut down your adrenal glands, but I had never been on prednisone, clearly, because I avoided it like the plague. So that was not what triggered my case of adrenal insufficiency. So yeah, so that was like almost to the day, like a year after I was diagnosed with Crohn's. So within the span of a year, I'm like kind of staring at two like pretty big, life-altering, lifelong chronic illnesses, and was kind of not sure what to do other than like get super overwhelmed. And like I was also, like I said, had just left a dream program of mine because I was so sick, and I was trying to figure out, what to do. And unfortunately, the AI was very, very difficult to control. They tell you, you take hydrocortisone, which is a kind of a derivative of prednisone, for the rest of your life. If you're ever sick, if you're in an accident, you have to take more because you can get into an adrenal crisis, which is when your body demands more cortisol than it has. And it can be very fatal and very scary. And my doctor, when I was diagnosed, like actually looked me in the face, and she's like, you were like one fall away from like a deadly adrenal crisis. She goes, your adrenal glands would not like wake up if you like ever went into shock or something. So that was a little scary. It was kind of like, yeah, she's like, you're one like big fall or COVID away from like a really, deadly situation. And I'm like, cool. That's nice to hear. Thank you for diagnosing me. I appreciate it. So unfortunately, after 6 months of taking the pills, I realized this isn't working. Like my body was not metabolizing them appropriately. Like I said, cortisol is something your body releases in a circadian, similar to your circadian rhythm. It releases a different amount throughout the day, but it releases it 24/7 in a normal person. And I wasn't releasing any. So like I'd wake up in the morning, having taken my last pill at like 4 p.m. I'd wake up with basically like no detectable cortisol in my body. I couldn't make it to the bathroom in the morning. I'd have to like crawl from my bed to the bathroom because I had no energy. Most days I'd set an alarm and like take my pill half asleep and go back to bed, and like wake up an hour later when it was like metabolized in my body. So for the first like 6 months of this like really, earth-shattering diagnosis, I had like zero quality of life. I actually had a doctor at a major medical center tell me that I needed to accept the degree of disability I was now living with and stop complaining. When I kept going to her saying, this isn't working, I'm not feeling well, I'm having these symptoms. And she was like, I don't know what you expect. Like, you're going to live like this for the rest of your life. And having an adrenal expert tell me that, I was like, no, I don't believe you. So I did what most patients nowadays do. I went online and I joined Facebook groups, and I found out that there's patients that were using it's called cortisol pumping. You basically use an insulin pump and put in, this liquid form of the medicine. Same way diabetics, sub-Q infuse insulin 24/7. People were doing this with hydrocortisone, with my medicine, and seeing these like astronomical results and improvements. So it became my mission to find a doctor who was going to do this for me. I tried 3 endocrinologists in the state of California, and they all laughed at me and told me that they either don't understand how it works, or they don't agree with it, or because it's still experimental, they won't support it. Long story short, I ended up with a naturopathic physician in Portland, Oregon, who I met through a Facebook group, who took it upon herself to learn all about this to help a patient she had. And she spearheaded everything for me. We would spend hours on Zoom over spreadsheets, playing with my rates and, all of this. And she helped me get, I started off on an Omnipod, a tubeless insulin pump system. And within 2 hours of putting that first pump on, my life was totally changed. Like that first morning I woke up, I didn't just open my eyes, I sprung out of bed. And I had not done that in like a year. My dog was like, what the heck is going on? Like, mom's ready to go in the morning, finally. And I remember sitting down and I emailed her and I was like, I actually like woke up this morning, and like, it still is not lost on me ever, kind of that miraculous shift in my symptoms and in my quality of life from all of that. So yeah, it's huge. And it's definitely difficult to kind of live with, multiple chronic illnesses, especially diagnosed in a short period of time, for sure.
Now that you have it done and you've seen these results, have you gone back to some of the other doctors that were a little more unfamiliar with this? Skeptical. Thank you. That's a good word.
That's a good word.
Thank you.
Yeah. No, unfortunately not. I also had a primary care at the time who refused to support this or understand it and kind of used it as leverage to drop me as a patient. So I've been met with so much skepticism that for a really long time, I kind of just like lived in my own world with it because I was just doing so well. And I'm thriving now from an adrenal insufficiency perspective. I can finally work out again, and I'm so active, and I can take my dog on hikes for miles and miles. And I feel so normal, so to speak. And I just couldn't like let anyone steal that from me. So it was really scary and hard for me to like even bring it up to any doctor, like even a GI doctor who's not going to touch that. It's an endocrinology problem. But I just like would get so scared of sharing this with anyone because of historically the doctors that wouldn't like not be willing to prescribe it, but like not even willing to acknowledge the life-changing, life-saving, arguably, impact it's had on my life. And so for a really long time, I also was like not really involved in the advocacy space around this condition because I just needed like some time to kind of just sit with it on my own. And I'm still to this day, processing some of those negative experiences from the diagnosis and from those first few months, and all the fighting I've had to do to kind of get to this point. It was also very stressful over the summer when I had that really bad leg infection from the Omnipod. We decided I couldn't use that pump system anymore. So I had to get a new insulin pump, and it is very hard to get them off label. And it was about a 5-week process of like praying every single day, every step in that process would go smoothly. And it was very stressful to know that like I deserve this and I need this to survive, no different than a type 1 diabetic, but yet I have to like choose my words very carefully in order to make this happen for me. And it was very, very, very scary to know that, it was actually, very unlikely that I was able to get the pump.
Wow.
And so that whole process again was like, like a grieving, very difficult, that fighting of like, is my life-threatening chronic illness not good enough for you? Like to have to, it felt very invalidating almost that I had to fight so hard and that I had to be so scared of if I was going to continue to have access to this therapy. And it's something now we're currently facing, unfortunately, a shortage of the hydrocortisone medicine that I put in my pump. And there's like a switch in the manufacturing, and, the company's assured that it won't affect it, but a lot of pharmacies are not able to get it and to fill it. And so I, been able to thankfully over the past few months do some stockpiling. So I likely will be okay, but it's like that fear of I don't have another option. I don't have another alternative. And should insurance change, should, all the things that we rely on change, my life is going to change. And it's scary. And I know that it's a feeling that definitely overlaps with IBD. And, I'm always fearful. I mean, my Stellaris ship today is out for delivery tomorrow, but until I get that thing in my hand and in my fridge, that anxiety, that stress over the 101 things that could go wrong, it's frightening. And, it's frightening to deal with it for one condition, but when you're dealing with it for all your medications or some of your medications, it definitely gets really hard and really scary sometimes when you start kind of running into those roadblocks and start to think of, all the what ifs.
So it sounds like through all of this, for your IBD diagnosis and also through this Addison's disease diagnosis, you've had to do a fair amount of having to really push medical providers to listen and to take you seriously and to listen to what you really want and need from your healthcare. And I think, unfortunately, that's not entirely unique to you. And that's something that a lot of folks deal with. But for people that are maybe earlier in their journey and feeling a little overwhelmed by this, what advice would you have for them to really figure out how to be your own best advocate with your healthcare providers?
I think it's challenging to kind of try to summarize what I've learned, because I feel like I've recently in the last year or so kind of gone through like a really big shift in my thinking, mainly due to like a lot of work and therapy, like trying to work on a lot of this medical trauma that, I thought was just like getting anxious when you walk into a doctor's office. No, it was affecting all my relationships. Like it was affecting all of my day-to-day interactions based off of, ways that I had interacted with the medical system in the past. So that was really interesting kind of for me to kind of be really introspective on how my journey has impacted all areas of my life. I think being your own advocate is very, very hard. And for some people, it comes more naturally, and that's okay. I'm definitely one of those people, which is kind of funny because I was so scared to talk to adults like as a child. And now, like, from the time I was like 13, 14, and like throughout my teenage years, I would sit face to face with these doctors and talk to them like I was a colleague of theirs. And I, for whatever reason, like when my health depended on it, was able to like get over any adult anxiety I had had as a child and like come to the table. And I've found a lot of power in being able to do that. I've learned a lot about myself, and kind of why I also have super involved in the patient advocacy space is because I've really learned how to communicate, not just one-on-one with physicians for my own needs, but I feel like there's a lot I've learned about how to communicate with them in a broader, professional and advocacy context too. But I think the hardest thing, and something that I'm currently dealing with a potential new diagnosis, and again, please listen to me. These are my symptoms. What's wrong? I struggled a lot with internalizing a lot of that. And, I would take kind of offense to when a doctor wouldn't validate or take seriously what I was experiencing. And I think that those feelings are valid. When you feel invalidated, that's okay. But trying to like think back and separate, like my doctor is just trying to look at me for the problems. And it's not my fault that I'm having these symptoms and that I'm bringing this to my doctor. I think one of the things that is still hard for me sometimes to deal with is when I'm on like a path to something, and sometimes I feel like I'm bothering my doctor or arguing with them about something. It's not like a personal attack. It's more of, we're just like, I'm a very passionate individual. And sometimes that can be very hard to navigate when you're dealing with, a situation where you're like, please help me. I'm sick and I'm suffering and I need your help. And they're sometimes offering help, that's kind of coming at a crossroads to what you actually need. And kind of learning how to deal with that for me is one of the biggest challenges still, and learning how to advocate for yourself. And it's never going to feel super easy or pretty or comfortable. I think that's what I'm learning once again. And, currently what I'm up against is that you just kind of have to get through it. And at the end of the day, I'm just trying to advocate for myself and my symptoms and my health and my well-being. And if they take it the wrong way, then so be it. I'm never malicious. I'm never, intentionally rude. But so I think that's one of the biggest things. Sometimes patients that are very good self-advocates sometimes come at odds with their physicians sometimes. And I don't think that's talked about very often, but I've found myself in a handful of those situations over the years, and it sucks. But I don't want other patients to think that there's anything wrong with them when that happens, because it's bound to happen. We're humans. And I think that hopefully, you won't let that get to you too much, because I've made the mistake of letting that really, get to me personally. You can work through that, and it's not all your fault.
It's not all your fault. And we are humans, but the doctors are also just people too. So they're going to have whatever normal human reaction they would have to any kind of conflict in their life if you are pushing back a little bit. So they may be conflict averse. They may not be good with confrontation. And I kind of vacillate between being that person that is like, no, I'm telling you that these are my symptoms and something is wrong. And the person that is so frustrated that I start crying, which is read the wrong way, because I'm not crying because, I'm trying to get attention. I'm crying because I'm so frustrated with you right now that you are not listening to me. And so that's even read wrong. So I feel like with you sharing all of this, the takeaway for me is, even though it's hard, even though it's exhausting, it's a good reminder for me to continue to push for what I know is right and what's happening in my body, because I'm the only person that knows, and I'm the only person that's going to be able to speak for myself because I'm coming from that place of knowing.
Yeah, I think one of our guests had said, the doctor might be an expert on IBD, but I'm an expert on my IBD. You're an expert on your body and you know what doesn't feel right. And it sounds like you're very in tune, Mara, with what's happening. And I know Robin is very in tune with what's happening. And so asking for what you need and pushing back when you're not getting it, I think is important. It's an important skill to learn. That's hard because there are those times where you're afraid that what you're saying or what you're doing is going to mean that you don't get something that you might need. But I'll see that fear can't get in your way of advocating for what you need longer term potentially. And that's a hard balance. I think it's a hard balance.
At the end of the day, it's your life. And, I always have to remind myself that the doctors always mean well, usually. But at best, they're seeing 10, 15 minutes of your life. And while they can have, and a lot of, especially in the IBD community, we have a large group of amazingly empathetic providers that really do, spend a lot of their personal time getting to know, the patient experience. At the end of the day, like we leave and we go home and we're the ones that have to live with that suffering. And so at the end of the day, yeah, like what Robin was saying, it's all about, how you choose to advocate for what's going on in your body, because you're the only one that really knows how important that given symptom or that given problem is to you. And that's something that I have to remind myself of sometimes is like, I need to fight for the Mara that can't exercise because she's having this problem or, had to miss work for this problem, and that can be sometimes really hard to remember when you're face to face with a doctor and, you're feeling that conflict potentially building. I've sometimes left appointments and be like, well, I just pretended that I was fine and I'm so not fine right now. Why did I do that? So I think it can also be hard to be honest with yourself at how much you need to be advocating.
I hate to say this, but we have been talking for more than an hour. So it's time for the last question. What is the one thing that you want the IBD community to take away from our conversation today?
Yeah, there was definitely a lot. I hope everyone enjoyed my laugh. I think that's a huge part of it too, is learning how to laugh and find humor where you can. I was born into a family that loved, poop humor, thank gosh. So it's something that definitely has been around most of my life and will certainly continue now that I like to play that game as well. So find people you can laugh with. I think that definitely helps. And that also goes with, again, find your people. I'm extremely active in the IBD patient advocacy space, primarily with the Crohn's and Colitis Young Adult Network and Generation Patient. And I have found an incredible community of young adults with IBD that have become lifelong friends of mine. And I've not only made forever friendships through my IBD, I've had, been able to take advantage of some incredible professional opportunities because of my IBD. And while there's a lot of negatives that come with this disease and will be a lot of, hardship and suffering that will come in the future, that's just a part of it. I've personally found so many incredible positives and things that have gone so right in my life because of this diagnosis. And that doesn't mean that I don't have days that I hate it and I'm upset and I'm mad and I'm pissed, and all of those things are valid all the time. But there's also so many great things that have come into my life because of IBD. And there can be some things to be thankful for in that diagnosis as well. So I think there's always balance and there's always, a happy medium. And, I encourage, everyone to try their best to find some ways that they can think of IBD in some positive way. And that doesn't mean it needs to be positive all the time, because it's definitely not. People think that when I say things like that, I mean that I'm expecting everyone to be all happy-go-lucky. Yay, I have IBD. That's not at all what I mean. But there are definitely some things you can think of, and wait, maybe this will be your motivation to get out there and meet other people with IBD for the first time and get involved in, the Crohn's and Colitis Foundation, activities near you, or go online and find a support group, because I think our IBD community is extremely, extremely special. And one of the big reasons that I'm able to laugh and smile and make all these poop jokes along the way.
I love it so much. Thank you so much for being a guest and for sharing so openly and so hilariously. And thank you, everybody, for listening. Cheers.
Cheers.
Hi, this is Mara. I hope you enjoyed the episode. And if you did, please rate, review, subscribe, share it with your friends, your doctors, maybe, and maybe even your dog.